For more on the vaccine rollout and all the latest on the pandemic, let's bring in ABC News contributor Dr. John Brownstein. Dr. Brownstein, good morning. You just heard there from Secretary Azar explaining some of the things the government is doing to try to speed things up. And one thing that Azar said was that they'll no longer hold back vaccine doses. But it sounds like the issue right now is more with distribution than supply. So will that help in the short run?
Yeah, so good morning, Diane. As we just heard, right, the problem probably right at this moment isn't about manufacturing and shipping. The problem is more with the administration. Releasing all the doses and not holding back second doses probably could help. So, right, the idea is pushing more vaccines out to the community, not letting them sit in federal warehouses. But we still have this last mile challenge, right? How do we expand sites, pharmacies, community vaccination sites? How do we get operational vaccination campaign to these large mass gathering sites like, for instance, sporting events? We need to set up field centers. It's not just about releasing the doses, it's about the logistics. And so the states are going to have to keep working out the kinks, identifying priority groups, building networks of providers. And I think the big issue that we're probably not talking about enough is the logistics and how do you figure out if you're eligible? It's really confusing. Every location has a slightly different eligibility, and then you have to find a confusing website and maybe book an appointment and deal with long lines. So there's a lot of issues at that last mile that we still have to deal with, regardless if we release those second doses.
So what do you think is the key to getting more people vaccinated?
Yeah, it's a good point. I mean, clearly it's about opening up more sites. I think this idea of blending groups, these phases, so phases 1A, 1B, 1C, starting to roll it out, expanding the ages, 65 and over, pre-existing conditions now become eligible. So again, that's a big part of it, is making sure more people are eligible. We also have to get willing arms, right? Like, this is something that we don't talk about enough, right? The vaccine hesitance and resistance we're seeing even in hospitals is quite high. So we need trusted practitioners proactively reaching out to high-risk patients. Again, we can't get into the same debacle as testing. We still don't have a national testing program, a year in. So lots of issues to work through that are beyond just the pure manufacturing side of this vaccine.
Yeah, that's for sure. And when the vaccine rollout first started, experts said the U.S. could reach herd immunity by late summer. Is that still possible?
Right. I mean, this is a real concern I have right now. I mean, the Biden plan does say that it's 100 million in 100 days. But as we just spoke about, I mean, there is a lot to do to achieve that number. We are looking at trying to get to 200 million people to get vaccinated to reach that herd immunity level. So we've got to pick up the pace, right? We're not even at 10 million vaccinated so far. If we want to get to that number, I mean, all these issues of logistics and reaching out to vulnerable communities, expanding into rural areas. Again, this is not going to just be met by expanding into pharmacies alone. I'm still very hopeful of the normal August, but we've got to pick up that pace.
Well, when you talk about things like expanding into pharmacies or in clinics, for example, the clinic across the street from me has a line around the corner every day for people looking for COVID tests, and that's not counting the other patients they handle. So how are places like that supposed to be expected to now also take on vaccine administration? And is that safe given the vulnerable populations that will then be going in there to mix in with people who are sick?
Yeah, I have such concern when I see those long lines. We don't want to turn a vaccination site into a super spreading site, right? You have long lines of people trying to get tested and vaccines. Our healthcare system is totally overwhelmed. That's probably why we saw such a slow rollout in the first few weeks. We have hospitals that are dealing with massive capacity issues right now, dealing with just fighting this pandemic. Now you want to expand into vaccinations. It's just not sustainable. And this is why we need innovative approaches. This is why we need to expand into sites, right? We have large sporting event facilities that we could be utilizing. We have places that are, convention centers, right? We don't have conferences going on. Again, we should be thinking about places that we can leverage that have huge capacity while not putting the burden on the existing infrastructure of testing and treating patients. It's a lot to expect. And then again, public health is not great at building technology. I would just say, as someone in public health, building appointment booking tools and figuring out eligibility. This is a real challenge. And this is, engaging with tech companies to help build out some of these tools is probably a smart idea as well.
And they're now saying that there's no max interval between the Pfizer or the Moderna vaccines between the two doses. Could that help?
Yeah, I mean, I think that's potentially, but I mean, again, this is this concern that we want to just get as many people with that first dose as possible. But remember, that first dose gets us between 50 to 70%. We want everybody to get that second dose. So I do have a little bit of concern about messaging, because this is not about not getting your second dose. And we also don't fully know what delaying that second dose means for immunity. So the best sort of solution is just to get that dose at the interval of 3 to 4 weeks and follow what the clinical trials have shown. But again, my other concern here is vaccine messaging. We keep changing some of the guidance. People are going to be concerned about what that means in terms of their own personal safety.
All right, Dr. John Brownstein, always great to talk to you. Thank you.
You too. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.